Hello, welcome to video 6 for Unit 5, Mental and Physical Health. This video will be focusing on schizophrenic spectrum disorders. By the end of this video, you should be able to answer the following question. What are the key symptoms and potential causes of schizophrenic spectrum disorders? So let's first start with what this group of disorders is. So schizophrenic spectrum disorders are a group of disorders characterized by delusions, hallucinations, disorganized thinking or speech, disorganized or unusual motor behavior, and negative symptoms such as diminished emotional expression. This group of disorders includes schizophrenia and schizotypal personality disorder. One of the key characteristics is the idea of psychosis. And psychosis is a severe mental state where a person has trouble telling what's real. It affects how they see, think, and feel, leading to things like false beliefs or delusions, seeing or hearing things that aren't there, hallucinations, and very confused speech or behavior. Nearly 1 in 100 people have schizophrenia, and throughout the world, 24 million people have this disease. This disease strikes young people as they mature into adults. Symptoms usually begin to appear between the ages of 18 to 20. This disorder affects men and women equally, but men usually have it more severely than women. The literal translation of schizophrenia is split mind. So it is a split from reality that shows itself in the following ways: disorganized and delusional thinking, which we call delusions; disturbed perceptions or hallucinations, so having a perception without there being sensory information; and inappropriate emotions and action. We aren't really sure on the causes of schizophrenia, but some of the theories are that a person with schizophrenia has high dopamine levels, has low brain activity in the frontal lobe, increased activity in the amygdala and thalamus, enlarged ventricles in the brain, and genetic or increased risk during fetal development. While we are looking at schizophrenia spectrum disorders, we do need to understand the difference between positive and negative symptoms. Positive symptoms are a distortion or excess of normal functions and tend to be the most frequent in the first stages or early episodes of schizophrenia. So positive symptoms are adding to normal functions. Some examples of this would be having delusions or those false or distorted beliefs, having hallucinations. Most frequently, these are auditory hallucinations, but can be any of our senses. Disordered speech, which often results in what we call a word salad, where the person's speech will come out fluently, but the words don't make sense together. And disorganized behavior, where we have motor behaviors that are inappropriate. The individual may perform senseless, compulsive acts like continually rubbing an arm or rocking in a chair. Negative symptoms, on the other hand, are behavioral deficits or the loss or decrease of normal functions. So this is the absence of appropriate behavior. These include flat affect or the avoidance of emotions. Usually this will look like avoiding eye contact, an expressionless face, apathy and non-interest, or a monotone voice. Another thing that can happen is the poverty of speech or long lapses of slowed speech or no speech at all. And then finally, the lack of directedness or slowed movements, a little interest in participation. Next, let's talk about the two key subtypes of schizophrenia, acute and chronic. Understanding the differences between these two can help us see how the disorder develops and affects individuals differently. Let's start with acute schizophrenia. This form has a rapid onset, meaning symptoms appear suddenly, often in response to a stressful event. People with acute schizophrenia tend to experience more positive symptoms, those things like hallucinations and delusions. The good news is that this subtype is often more responsive to therapy, and with treatment, recovery is possible. On the other hand, chronic schizophrenia develops slowly over time. Instead of sudden episodes, individuals may gradually withdraw from social interactions and show signs like flat affect, where they display little to no emotional expression. Another symptom is catatonia, which can involve long periods of stillness or repetitive, meaningless motion. Unlike acute schizophrenia, chronic cases are less responsive to therapy, making long-term management more challenging. So next, let's talk about the etiology or causes of schizophrenia. Let's start with the biological factors. One key discovery is dopamine overactivity. Studies show that people with schizophrenia have higher levels of dopamine D4 receptors in the brain. This excess dopamine activity is linked to symptoms like hallucinations and delusions, which are common in schizophrenia. Brain imaging has also revealed abnormal activity in multiple brain regions. For example, scans of schizophrenic patients show low activity in the frontal lobes, a part of the brain responsible for planning, decision making, and impulse control. Meanwhile, too much activity in the thalamus is associated with those hallucinations, as this region helps process sensory information. Another important finding is that the greater the shrinkage in the hippocampus and amygdala, the more severe the disorder tends to be. A smaller thalamus can also make it harder for individuals to filter information and respond appropriately to their environment. Next, let's talk about genetic factors. Studies have shown that genetics play a significant role in schizophrenia. According to Gottsman in 1991, if one identical twin has schizophrenia, the other twin has a 50% likelihood of developing the disorder as well. This suggests a strong hereditary component. Researchers have also identified several early warning signs that may indicate a higher risk for schizophrenia. These include a mother with long-term schizophrenia, suggesting a genetic predisposition, birth complications such as oxygen deprivation and low birth weight, which may impact brain development, cognitive and motor difficulties like short attention span and poor muscle coordination in childhood, social and emotional difficulties, including withdrawn behavior, emotional unpredictability, and difficulty forming peer relationships. Recognizing these risk factors is essential for early intervention and treatment. While schizophrenia is a complex disorder with no single cause, understanding the interplay between biology, genetics, and environment helps us take steps toward better diagnosis and care.